Good morning, everybody. I want to take a moment to acknowledge my colleagues who've joined us. We've got senators and House members standing here today in support of contraceptive access in Pennsylvania. We've got Representative Paul Friel, Representative Mary Isaacson, Representative Dan Frankel, Representative Danilo Burgos, Senator Amanda Cappelletti, Senator Maria Collette, Representative Lisa Borowski, and Representative Joe Hohenstein. Some of these folks are headed to other voting meetings, but we appreciate their support in standing here today. Now, I know you saw on the press release that we talked about a giant inflatable IUD. Don't worry, it will be here in this spot at 12 o'clock for the rest of the day for you to stop by and take your selfies with FreedaWomb, a 30-foot inflatable IUD that's sponsored by the Americans for Contraceptives, who are helping to shine a light on the need for policy change to protect birth control. Over 3 months ago, the Pennsylvania House passed my bill, House Bill 1140, the Contraceptive Access for All Act. Simply put, this bill protects and codifies access to contraceptives here in Pennsylvania. There are currently no protections in Pennsylvania state law for contraceptive access, and we need to make sure that Pennsylvanians have access to the medications they need. I have been working on this issue for 7 years, and I've been working on it ever since. In 2017, we had a change in administrations that put our reproductive rights at risk. The need for this bill became even clearer after the fall of Roe v. Wade, when 2 years ago, Clarence Thomas, in a concurring opinion to the court's decision to overturn Roe v. Wade, said that he would do away with the doctrine of substantive due process and explicitly called on the U.S. Supreme Court to overrule watershed civil rights rulings, including Griswold versus Connecticut. Griswold versus Connecticut was a 1965 Supreme Court decision that established the right for married couples to buy and use contraceptives. That same law was expanded to other couples a few years later. With our current U.S. Supreme Court signaling that access to contraceptives are in jeopardy across this country, and with extremist politicians introducing bills at the federal level to threaten our reproductive health care, we must take action in Pennsylvania now to protect the rights that we have. Contraceptives are health care, plain and simple. Contraceptives are used to prevent unplanned pregnancy, but they are also used to treat other medical conditions. Research shows clear non-contraceptive health benefits of these medications, including decreased bleeding and pain with menstrual periods, reduced risk of gynecological disorders, endometriosis, pelvic inflammatory disease, and PCOS. A significant percentage of contraceptive users in the United States use contraceptives for a reason other than simply preventing pregnancy, such as regulating one of these medical conditions. When we sign the Contraceptive Access Act into law, we will put a stake in the ground and say, here in Pennsylvania, you and your health care are protected. Through this critical legislation, the people of Pennsylvania will be protected, and we will ensure continued access to the contraceptives they need now and for future generations. We will not go back. The Pennsylvania House passed House Bill 1140 3 months ago. But the Senate has not yet taken any action on this bill. We have 10 scheduled session days left before the end of November. There's plenty of time for the Senate to move this bill and take action.